My name is Lyndsay. I'm going to be demonstrating how to insert an NG tube today. The first thing I would do is check my doctor's orders, establish the type, size, and length of the NG tube I'm going to be inserting, and then also looking at the type, it's going to be suctioning. Next I would go ahead and prepare my equipment, make sure I have everything I need. Right now I've already got my pieces of tape laid out, I've got gloves, the tube, the lubrication, my safety pin, something to irrigate it with, and then a towel to place in my water cup for them to swallow while inserting. Next thing I'm going to do is I'm going to go ahead and walk into the patient's room, wash my hands, and ask them their name and date of birth, bring that with their wristband and the doctor's orders. I'm then going to go ahead and just position them. So I'm going to make sure they're in a high balance position with their head up. Go ahead and take their reel down so I can get a hold of them. So today I'm going to be placing an NG tube. I'm going to ask them if they have any questions, make sure they don't have any allergies to some of the things I'll be using on them. I've already washed my hands, so next thing I'm going to do is I'm going to go ahead and measure how long I need to make my tube, or how long I may be putting this in. The way I measure this is going from the nose to the ear, and down to the xiphoid process. So down to the xiphoid process, I'm going to take this point so that I know about where I should be stopping when I'm inserting this. Alright, so I've got that taped. Next I'm going to go ahead and set the patient up. So I've already got them in the high value position. I'm going to go ahead and drape a towel over their chest. I'm going to put this bucket here with their water. And I'm going to go ahead and put on my clean gloves. So I'm about to insert this. I'm just going to need you to rest your head back against the pillow.
Knock, knock. My name is Sam. I'm your nurse for today.
And I'm just going to go ahead and inspect your nares for patency and that there's no deviation, as well as the oral cavity. I don't see any obstruction, so I should be able to place this well. Alright, so we've got your head tilted back. And I'm going to go ahead and take my tube. I'm going to lubricate it about 4 inches. And then I'm ready to begin placement.
Assembly for
this. So I'm going to slowly advance.
I have also compared the MAR to the doctor's order.
Certainly, I'm going to go ahead and check the back of the throat. There's no coiling, so at this point I'm going to ask the patient to bend their head forward. And they're going to be taking sips of water as I advance this every time they swallow further down. I'm going to keep advancing until I get to about where my tape measure stopped. And then I'm going to temporarily tape this on their cheek so that I can check my placement. There. Go ahead and rest their head back again. And the way I'm going to check placement is I'm going to ask them to speak. Then I'm going to go ahead and get this ready. I'm also going to inspect the posterior pharynx again, make sure there's no coiling back there. And then I can aspirate the gastric content, noting the color. Depending on where I'm working, I may have to check the pH, make sure it's acidic. So I've got gastric contents in here. And I'm going to go ahead and auscultate the gastric area as I replace this fluid. So I'm listening for gurgling and swishing sounds. Alright. Then, after I've determined that, I'm going to go ahead and call for a chest x-ray to verify for sure that it's placed correctly. So, now that I believe it's placed correctly, I'm going to go ahead and tape
both nails and see
the
which
NG
one
tube
I will also
using
factor
a wide
into
piece
the assessment
at the top of the nose
if there is any redness, swelling,
and wrapping it around the tubing.
or any form of leakage. Okay. So with all, whilst I'm doing
And
this,
placing
it is also
another
important to use my pen light to check the nose
over the bridge of the nose
and
to
then
keep
also
that in
check the
place.
mouth to see that everything is, there's nothing
Alright.
in the mouth.
Oop,
So
I also
with
should have
this,
checked and
I will
made
begin
sure,
the procedure,
compared my baseline piece of
performing
tape
my
to where it was
handwriting,
actually inserted,
putting on
because
my
they should be
gloves.
pretty similar if it
However,
was placed
before I
correctly.
start, I need
Next,
to
I'm going
assess how
to
far
go
this
ahead
tube
and
will go. So what I will
hook
do
this up
is
to
I will
suction,
place
low intermittent
the
suction,
tube at the tip
then
of
going
the
to
nose
safety
to the
pin
ear,
with tubing
and then to the diaphragm
to
area
the
and take the
patient's gown.
measurement.
I want to make
And with
sure
this, I
that
see it at 65. So I'll put a tape there so that when I get there,
there's enough
can
room
stop.
for a little bit of movement.
then
While I'm pinning this, I can instruct the client to
so now that
make
I
sure
have
that the
the
bed
measurement,
stays at above a
I
30
know
degree
how
angle
far I need to go.
to avoid versicular aspiration. I'm going to tell them that if they need anything,
And before that,
call the nurse, or if there's any
I have my gloves on.
discomfort,
It's very, very
to call me
important.
as well. I'm going to, what's it called? So once it's pinned, I'm going to go ahead and position them in a comfortable position, making sure it's greater than 30 degrees. I'm also going to be performing oral hygiene every 2 to 3 hours. And at this point I can take off my gloves and wash my hands. And then I'm going to document that the patient tolerated the procedure well, that they were educated, I'm also going to be documenting the size, type, and length of the NG tube. I'm going to note the color consistency and the amount taken of gastric content taken out and replaced, and the date and time. Next, after this has been suctioning for a while, I would come back to irrigate it. So the first thing I'm going to do when I come back to irrigate it is I'm going to again walk in the room, ask my client's name and date of birth, check that with the borders in the wristband. I'm going to go ahead and wash my hands again, and then place gloves on.
Till I get to the stage.
I'm going to reposition my client so that they're in a high Fowler's. I'm just going to go ahead and put this on here. This imaging happens while I'm irrigating. The next step is to disconnect the tubing from suction. First I'm going to take a 30 milliliter syringe and aspirate gastric contents. And this is just to check for placement again before I start irrigating. So I'm again going to listen to the left gastric area as I replace these gastric contents, listening for swishing and gurgling. Alright, I hear the gurgling, so placement seems fine. I'm then going to, I don't have another syringe, so I'm going to go ahead and say that this is a 30 milliliter syringe of normal saline. So I'm going to get my 30 milliliters normal saline, and I'm going to go ahead and irrigate, making sure there's not any like obstructions, that it's going in pretty easily. Once I've instilled the contents, I'm then going to draw back up until I don't get anything else. I should get pretty close to what I instilled. I go ahead and say that I was able to get 28 milliliters of the contents back into the syringe. At this point, I'm going to just take note of the amount that I got back, the color and consistency of the fluid. I'm going to disconnect and discard the fluid that was taken out. I can then place my tube back on to suction. I'm going to ask the patient if comfortable, reposition them between semi-Fowlers and high Fowlers, and then I'm going to, I can go ahead and take my gloves off again. Going to wash my hands. If there's any patient teaching I need to do, I would do that at this point, and then I can go ahead and document. I'm going to be documenting again the time and date the amount that was instilled, which was 30 milliliters, the amount that I was able to draw back, which was 28 milliliters. And I'm going to note the color, the consistency, maybe the pH of the secretions, and how the patient is doing, how they're tolerating it, and anything that I taught them with this procedure. And that's it.
Yes,